given with the scientific name of Canis lupus, is the largest extant member of the dog family of mammals. Its head is big and long and high foreheads. But contrary to your perception, my dear tiger, wolves are friendly, social, and intelligent. Their sense of family is strong and loyal, with carefully defined rules and rituals. They are the epitome of the wild spirit. Good afternoon, ladies and gentlemen. Come and join me in this mission as we will rescue Tarzan. And along with our journey, we will define the classification of pelvic fracture, its assessment, signs and symptoms, laboratory works, and diagnostic procedures. So let's begin with the classification of the pelvic fracture. So let us recall first what are the types of fracture. We have the stable fracture and unstable fracture. In stable fracture, wherein the pelvis has one break point in the pelvic ring with limited bleeding and the bones are staying intact. While in unstable fracture, it has two or more break points in the pelvic ring with moderate to severe bleeding. So let's proceed with the different classification of the pelvic fracture. So we have the Young and Burgess classification. In Young and Burgess classification, wherein the fracture is based on the mechanism of the injury and the direction of force. The second classification is the Kane modification of Key and Caldwell. It is more on morphological. It's based on the number of breaks and the result of the X-ray. We have the third classification is the Tile classification. It has three groups. It's based on the energy, the mechanism, and the direction. So let's go into this different classification of pelvic fracture. So let's start with the Kane classification. In Kane classification, it has four types. In type 1, there is a fracture of the individual pelvic bone with no involvement of the pelvic ring. In type 2, there is a single pelvic fracture. In type 3, there is already a double pelvic fracture. And in type 4, there is an acetabular fracture. So this belongs to our patient Tarzan, where the acetabulum has been fractured. So let's proceed with the tile classification. Tile classification, it has three types actually. In type A, there is a stable pelvic fracture with no involvement of the pelvic ring. In type B, there is a partial stable of the pelvic ring. In type C, there is already unstable pelvic ring injury. Okay? So let's proceed with our assessment. So prior to that one, let us not forget the third classification, the Young and Burgess classification. It has three patterns actually. First is the lateral compression. In lateral compression, wherein it is associated with soft tissue and genitourinary tract injury. The second one is the antero-posterior compression. It is already, there is a symphysis pubis disruption. The last one is the vertical shear. So in vertical shear, it is already associated with the soft tissue, with the vascular, with the skin, and even urologic injury. So let's proceed with our assessment. So in assessment, we will discuss with the physical examination, the laboratory works, and the radiologic evaluation. So let's start with the physical examination. A careful physical examination is part in every trauma patient's evaluation and should be performed following the primary survey. So let's start with the physical examination, okay? So in every evaluation or every trauma patient should be assessed on the airway, the breathing, the circulation, the disability, and the exposure. Inspection may reveal an ecchymosis, an abrasions, an hematoma over the pubis, or bleeding in the urinary rectus is significant for associated lower genitourinary tract injury. Okay, palpation of the iliac crest or the anterior pubis is suggestive for an increase in vascular injury and bleeding. Internal rotation of the lower extremities or a frog-leg position may indicate an abnormalities in the pelvic ring. Complete rectal and pelvic examination to assess for bleeding, rectal tone, and in women if there is a vaginal wall disruption. We have to check the position of the prostate gland in men for a high-riding prostate, which may indicate a lower genitourinary tract injury. So we really have to assess the lower extremities for paresis, hyposthesia, alteration in the distal pulses, and ankle jerk reflexes, which complicates lower genitourinary tract injury. So we really have to, don't you know that 1/3 to 1/2 in every trauma patient have an elevated blood alcohol level, which complicates the assessment and masks the abdominal pain? So we really have to monitor the fluid volume status, its hemodynamics, its urinary, and central nervous system parameters. So we really have to notify our physician if there is a delay to the capillary refill, there is tachycardia, there is a decrease in the urine output of 0.5 ml per kilogram per hour, and alteration in the mental status such as confusion, agitation, and restlessness. So as you can see on the picture, this is a Destot sign. A Destot sign, it is clinical sign where you can see a superficial hematoma in the upper ligament of the inguinal and even the scrotum, in the perineum and the upper thigh. So this is the perineal ecchymosis, and this one is the Roxy sign. So Rox sign, it is a decrease in the distance from the greater trochanter to the pubic spine of the affected lateral compression fracture. So these are the different signs and symptoms in patient having a pelvic fracture. So let's move on with our laboratory work. So in the laboratory works, the doctors routinely ordered for the blood chemistries, the urine analysis, the coagulation profile, the D-dimers, the PT, APTT, and even the cross-match. So let's proceed with the diagnostic procedure. So in diagnostic procedure, there is a plain film of the pelvis. So you can see, normally it should have an intact bony structure. But if there is an abnormal findings, you can see there is demonstration of the fracture and injury. So it shows the location of the injury to our patient. So we have also the ultrasound. In ultrasound, you can see if there is an intrapelvic bleeding or even fluid accumulation. So it shows if there is a bleeding, the location of the bleeding to explain shock to our patient. So we have also the CT pelvis. So in CT pelvis, it assesses the pelvis, the sacroiliac, and even the sacral injury. So we have the MRI of the pelvis. So in MRI, it is indicated in urologic injury. So let's proceed with the radiologic evaluation. This is a unique skeletal evaluation in every trauma patient. So this is an AP pelvis. So in AP pelvis, it represents into three concentric circle approach. So the inner portion or the arcuate line, the middle, and the outer portion of the pelvic ring. So in advanced trauma life support guidelines, so in an AP pelvis film is obtained once the patient is stabilized. So the doctor usually orders this one and should be interpreted. So this is the CT pelvis. So in CT pelvis, it replaced the supplementary plain film because it has a greater anatomic detail and the best study for acetabular and sacral fracture. So it also assesses the extent of instability and evaluates a retroperitoneal hematoma. So the last one is the angiography. Angiography, this is a method of controlling a life-threatening arterial hemorrhage in a pelvic fracture. It is indicated with hemodynamic instability in patient with pelvic fracture, has ongoing negative fast examination, and a hypotension. And also, it evaluates if there is a larger hematoma seen at the time of laparotomy, and more than 4 units of blood in pelvic bleeding in 24 hours, and more than 6 units of blood in pelvic bleeding in 48 hours. So it assesses and evaluates if there is a neurologic injury seen at the time of CT imaging. Are you still there? Yes. So, mission accomplished. But I really have to go. But don't worry, I'll give you to a friend who is actually bigger than me. You can easily identify her with its black, brown patches over the eyes, on the nose, and all over her body. So, let me introduce to you Panda Bear.
I can associate myself to a bear because bears are highly evolved animals with intelligence. This proves myself to be affectionate, devoted, and protective.